Hello, I'm Dr. Marla Shapiro. I'm a past president of the North American Menopause Society. And today we have a very, very exciting podcast and video for you to look at. I'm joined by Dr. Susan Reed, who's the 2022-2023 president of the North American Menopause Society. Welcome. She's a professor emeritus in the Department of OB/GYN and adjunct professor of epidemiology of the University of Washington School of Medicine in Seattle. Now, for our women who are out there, we know that many of you suffer with hot flashes and night sweats. Yet our data shows us that many women don't come forward to be treated because they're either fearful about side effects or think that there's nothing safe and effective, and they really do suffer in silence. So we are really here to change that today and to review what's out there, and now a very, very exciting moment in women's health, which is a new medication, a different class of medication that perhaps you're hearing about in the news that we want to explain to you. So firstly, thanks for joining me. And before we go on to what's new and exciting, let's just remind our women about menopausal hormone therapy and who's a candidate and why we still consider it that gold standard for the treatment of hot flashes and night sweats.
Sure. So menopausal hormone therapy, within the last year, a lot of press around women receiving misinformation and disinformation about hormone therapy. I think the media and the healthcare system has not done a good job of messaging around hormone therapy. Overall, it's incredibly safe for healthy individuals who are under 60 years of age with minimal risks. But there are individuals that cannot take hormone therapy. Those that have unexplained vaginal bleeding, if they have a uterus, if you have liver disease, a prior estrogen-sensitive cancer, such as breast cancer, prior heart disease, stroke, or leg clots, clots to the lungs, or other problems that your clinician or physician would suggest to you should be a contraindication. But those are the main reasons.
And then there's just women who just won't, for whatever reason. They feel very strongly against it, and many of those women feel abandoned, that there's nothing else that they can use. So as of early May, we have something very new and exciting, and I say that because in all the historical approaches that we've had looking at treatment of menopausal hormone therapy, there have been a variety of different hormones, routes, formulations, preparations, but we haven't had anything that has been really on label that's as novel as this. We have had the use of some low-dose antidepressants, paroxetine, that we've used for women with hot flashes. Doesn't work as well as menopausal hormone therapy. But I want you to explain what is new about what has just been launched. First country in the world is the United States. So watershed moment for America, and I think rest of the world will follow. But tell us what has just been released.
Yeah, so we really have had nothing exciting since 1942 when estrogen hit the charts. We have one other FDA-approved drug, which is called paroxetine, and it decreases hot flashes by about 1 to 1.5 hot flashes per day above a control group. But what we're seeing with this new non-hormonal group of drugs is decreases of hot flashes, and these are the worst hot flashes, moderate to severe hot flashes, of perhaps even up to 5 per day, on the order of 3 to 5. And if we look back at historical data from estrogen, the improvement over the control group or placebo was really only around 2.6 hot flashes per day. So we may be meeting the mark of hormone therapy or even see more benefit. We'll need to do special studies to look at the differences between hormone therapy and this new non-hormonal in patients that it's safe for.
So we've learned that there is a complex within the brain that's responsible for controlling our body thermostat, if you will. And that when we go into menopause, with estrogen being removed, because menopause is all about estrogen depletion, these hormones, these brain chemicals and the neuroreceptors go a little wonky, if you will. They grow quite big, and then off to the races we go with these hot flashes and night sweats. So how does this new medication work? Since it's not a hormone, what is it doing in that area of the brain?
Yeah. So it works upstream from where estrogen works, if you will. It works at an area above where estrogen impacts hot flashes. So you are moving directly to the place in the brain that impacts how we control our temperature. Hot flashes happen because we get dysregulated. Our brain thinks we are cold and makes us warm with flashing. And it sometimes makes us think that we are cold and makes us shiver a bit. Some people will describe this with menopause. Less talked about as much as the hot flashes, but indeed, you get problems with either end of thermoregulation at the time of menopause.
So this isn't estrogen. This
Mhm.
works differently on this brain complex, and it brings things back into more of a seesaw balance, if you will.
Yes.
So what can women expect in terms of if they take this medication, how long it will take to work? You've talked about how effective it is, but you need to be on it for a long period of time till you notice that difference.
Yeah. So with hormone therapy, we know that it takes often 4 to 8 weeks to get an effect. And the lower the dose of hormones, the longer things will take. For this new class of drugs, we see relief within 1 to sometimes 2 weeks, but often rapidly within days. And that improvement seems to be plateauing out fairly rapidly between 2 to 4 weeks. That the benefit you get is going to be maintained, but is very, very, very rapid initially, which is nice to feel better fast.
Yeah. One of the things that we've learned in menopausal hormone therapy is that there's a so-called window when it's safer to use. So we
Mm.
talk about newly diagnosed menopausal women under the age of 60. But because this is not a hormone that is working on the brain, does that carry the same type of baggage in terms of the window of when you must start or when you cannot start?
Yeah, to the best of our knowledge, no. Now, the studies that have been done to date have been in women up to age 60 years of age. So for efficacy, there's nothing to suggest that it's going to be different for an older individual. Safety may get a little bit more challenging. So we're going to talk about that in just a minute. As we age, our bodies age, and any medications we take, as many of us know, we have to be careful about how the aging body handles any medication.
Now, when we look at this medication versus hormones, we know that there are estrogen receptors in the breast, for example. So we worry in older women how it impacts in the breast. We worry about blood clots. We worry about the cardiovascular because of estrogen receptors and it's impacting. But these do not work on estrogen receptors. So in terms of those concerns, can you mention something?
No evidence that there's a concern for those kind of safety concerns whatsoever. The concerns that have been seen with this medication and to cousins of this same kind of medication is that it works on receptors or areas in the body that are not only in the brain, but throughout the body, and particularly so in the liver. What we've learned from long studies of this class of drugs is that if you push doses of these medications higher, you're more apt to perhaps see some changes in the liver. What we've seen with the development of the drug that was FDA approved, the initial doses on that, I think, were 180 milligrams, and now we see that the dose that was approved was 45 milligrams. So they backed off threefold from those initial studies. And it looks to be incredibly safe for people who are otherwise healthy and do not have problems with their kidneys or particularly their liver, so that they are metabolizing or breaking down this drug properly and not affecting other systems.
I think one of the most exciting things for women who are listening to us is that having a new medication with a new mechanism of action opens up the door to talk about this again. It opens up the door to talk about menopause and educate women.
Absolutely.
Excuse me. So I want to thank you so much for bringing this to our audience so that they're aware that there's something new. Please speak to your healthcare provider if you have interest or more information to learn about what's happening in women's health. It's an exciting time to be a woman and an exciting time to be a healthcare practitioner.
Thank you so much.
Thank you for joining us.